Good afternoon and welcome. My name is Anna Rowinska and I am your technical host today. Thank you for joining us as we discuss COVID-19 Town Hall with Medical Officer Michael Schwandt. First, we want to make sure that you can hear us well. If you have any problems with your audio, please click on the bottom left where you see your microphone and click on the up arrow where you can select a number of features that will assist you. A reminder that everyone is on mute at the beginning of this webinar. We want your questions during today's session. Although your microphone is not enabled, you can send us your questions at any time through the Q&A button. Please use the Q&A button for questions only. If you would like to leave a comment or would like to share an opinion, please use the chat option as we will only answer questions from the Q&A section. If we can't get to your question today, we'll be sure to get back to you via email after the presentation. Our moderator today is Lisa McGuire, founder and CEO of the Manufacturing Safety Alliance of BC. Welcome, Lisa.
Thank you all for joining today. For those who don't know us, the Manufacturing Safety Alliance of BC is a not-for-profit health and safety association serving manufacturers and food processors. Please call on us to answer your health and safety questions to help keep your workers safe. You're also welcome to visit our website for safety training and resources or information on the Occupational Safety Standard of Excellence core certification for BC manufacturers. This town hall is co-presented in partnership with BC Food and Beverage, also a not-for-profit association that we've worked together with over many years. The rise of variants in the third wave of this pandemic has driven numbers of COVID-19 positive cases to the highest level we've seen, increasing hospitalizations and occupancy of critical care units both in BC and across Canada. The provincial health officer has strengthened province-wide restrictions on March 29th with additional measures in April, extending until May 25th in an effort to reduce COVID-19 transmission. This has also impacted our workplaces, communities, and families. Vaccines have had a tremendous positive impact, providing protection from the devastating outcome of the virus. It is a race to get all of us vaccinated with priority given to those based on risk. Today, in the heat of the variants versus vaccine battle, we're here to provide you with answers on how the new provincial health orders impact you and your workplaces, especially if COVID-19 positive cases are detected, and how the vaccinations are prioritized using the risk-based approach. Here with us today is a familiar guest, Dr. Michael Schwandt, who has consistently shared his time with us in addition to working the long hours on the front lines throughout this pandemic, taking the time to be here and to provide answers to the many questions you've brought forward throughout this pandemic and here today. We'd like to begin with a thank you and welcome from joining us once again, Dr. Michael Schwandt. And for those who don't know, Dr. Michael Schwandt, he's a medical health officer at Vancouver Coastal Health and also a clinical assistant professor in the School of Population and Public Health. Welcome, Michael, and a pleasure to have you join us here today.
Hi there, glad to be with you. Thanks for the introduction and thanks to everyone who's joined in for another update call today. Glad to share some information on where we are in the pandemic right now. It's been a challenging time in many ways, and also with the arrival of and the continued rollout of our vaccination program, a time for a transition into a different phase of our pandemic. But we are, as you've heard from our provincial health officer, Dr. Ronnie Henry, it's certainly not over yet. There's a lot of work ongoing, and the partnership with this sector is extremely important right now. So glad to be here with you today. I'll share a screen if it works well for everyone. I'll give a little bit of a presentation on the current state of the pandemic, as well as the vaccination program and how that would affect many of the members who are on the call right now. And then hopefully we'll have some ample time for questions. I'll try to not take too long with the presentation side of things. I'm just going to click my way into sharing screen now, and the Manufacturing Safety Alliance and partners for hosting this presentation tonight. This afternoon. I just wanted to note that Vancouver Coastal Health operates on the traditional territories, Musqueam, Squamish, and Tsleil-Waututh peoples, Coast Salish Nations. this is where I'm operating from personally myself, and I think that's always important to note as a health authority. And I know people in this call are in different areas of land as well. In terms of the today's presentation, as I mentioned, I'll look at the current state of COVID-19 in BC, talk a little bit about workplace clusters specifically, obviously of relevance to this group, and then give a vaccination update as promised, and some time for questions. I wanted to note, you'll probably see some familiar data I've drawn from recent presentations, both by our provincial government as well as some of our local data and VCH that hopefully is relevant for other regions as well. Just wanted to put the background of where some of this is available here. And I think this can be circulated afterwards too. Now, first of all, the current state of COVID-19 in BC, you'll see here that we have we've had recently quite an increase in the cases and during our third wave. This has been quite severe, as you've seen. We've had an uptick in hospitalizations following that. We know that even with vaccination of a large number of people at extreme risk in long-term care and older adults, that some fraction of people who are infected with COVID-19 will continue to be hospitalized. And unfortunately, that has tracked along with our increase in cases. You will also see that the number of deaths has not increased in that way, with the very high coverage of vaccination among those who are most fragile, most vulnerable to extreme COVID-19 illness. We've seen a relative decoupling of death, of the rate of mortality from the case counts that we see, which is of course a positive thing, but we still need to manage those case counts to protect our health system with all of the hospitalizations you see in this graph. And it's absolutely vital that we get this third wave under control with a variety of interventions. Unfortunately, as you can see in the numbers here, we've had over 1,500 deaths from COVID-19 in the province, and we need to protect the health system and limit those further really tragic deaths. Now, this varies quite a lot across the regions. This kind of interesting graph here is showing those rates in each of the 5 different health regions. You'll see from left to right, and then within these health regions, you see the large difference between different cities. So you might be aware that Surrey has quite a bit higher incidence than some other communities within Fraser Health. And you'll see similarly where I am in Vancouver, Howe Sound, which includes Whistler, has had a lot more incidence than some other areas, such as the Sunshine Coast, our lowest area of incidence. And we know that some of the things that drive that could be determinants of health, including housing, the nature of work that people are engaged with and so forth. I just wanted to highlight that when you see a single number, our current cases across BC, that can sometimes obscure quite a large variety in the incidence from place to place. Looking at that again, you'll see here the differences in COVID transmission by age. You'll see here that young children, and as well as that our older adults have been relatively protected in the current wave. You see people that might include many people on this call right now, people in that 19 to 39 age group, people in the next decades up, being at the greatest risk and making up the bulk of our current cases. Again, this is just showing that one more way, more or less splitting down the different regions. So we see that Fraser Health and Vancouver Health, Northern to some extent, have had the largest number of cases. To some extent, the hospitalizations have continued to increase, but again, we see deaths being relatively stable and low at this time. And we see a little bit of a hint, although we're certainly not celebrating yet, that the recent surge in cases we've had maybe starting to abate in some areas. Now, there's some challenging news too, with the number of variant cases that we see continuing to increase. This makes up certainly the majority of our cases right now, around 63% in this recent analysis by the BC CDC. The P1 or Brazilian variant making up a large portion of that. And we see this continuing to in the UK variant as well. And this has just continued to climb, being more transmissible variants. It's expected that these will come to make up the majority of our transmission within British Columbia. So key points, as you've heard from our province, and definitely would reiterate those: we need to suppress transmission as to the lowest rate that we can. We need to avoid overwhelming the healthcare system, both to include for reasons of COVID-19 directly, and also to provide quality care for other important health issues too. At the same time, we need to think of the health of British Columbians outside of COVID-19. So certainly people's physical and mental health needs that don't relate to COVID-19 infection need to be thought of too. And so that includes being able to have our social connection and work ongoing. And this is just one more of these graphs starting to show this. This small and somewhat promising early decline in cases that I described earlier. I did want to share this, spend a little more time on it than I did on the earlier graphs. If you look back in December of 2020, in that leftmost distribution of cases by age, you'll see that sort of large bulge indicating a large number of cases in older adults, certainly people 90 plus making up a large number of the cases that are described here. As of March 2021, these hospitalized cases are much less likely to be in these older age groups. And this is because of the vaccine coverage in those age groups. We've had, even with increasing transmission, good protection of those age groups. And this just goes to show how effective vaccination has been as an intervention. And I think some of the benefits that younger and younger age groups will continue to reap over time. It's really a large difference when you look at these two distributions over time. Unfortunately, right now, we do have a lot of pressure with hospitalizations of COVID-19 patients. We know that's impacting on care. And we also know that the impacts on business have been really strong. And we need to think of the impacts on people's well-being going ahead. So to that end, you'll know about some of these public health orders and restrictions. Most of them are in the news on a day-to-day basis. Indoor dining in restaurants and pubs has been suspended for the time being, given the risk of transmission between people who are indoors in close contact with one another. We know that Whistler, Blackcomb, the mountain has been closed given the risk of transmission and the large outbreak that was observed there. Limitations on travel, such that people are not meant to travel between health regions if it's avoidable, and then some of these other interventions that are listed out here. One that I'll talk about a little bit later on is some of the new guidance around workplace closures, which will be important to many people in this sector. The new guidance that workplaces will be closed at a certain threshold for cases on the job. And that's something I'll definitely share in later slides. So about those workplace clusters, I'm going to show you two different slides, one looking at Vancouver Coastal Health and one looking at Fraser Health, because these are the regions with the largest number of cases. These are the areas that have conducted this analysis, looking at where's the transmission in workplaces. In Vancouver, restaurants, bars, and lounges, that sector of hospitality is a major source for our transmission that we've observed, at least within this type of transmission, workplace transmission. We also see some transmission gyms and fitness and other fitness centers, and then to a smaller extent in some of these other workplaces that you see described here. Then over in Fraser Health, the next slide, we see a very different picture. We see that food processing and manufacturing sector, well represented on this call, has made up a larger proportion of those cases. So this has been an area identified for risk by the nature of the work, often with people in close contact for long durations around the world, really. And certainly within British Columbia as well. And Fraser Health has seen a fair bit of transmission in that area. So we do see attempts, and I think that the Fraser slide is not displaying, but hopefully I've been able to communicate that in words, that this is a major risk. And I think that this slide, that this is from Fraser, shows the risk. It's not just to the people in that work site. We have this example of transmission flowing from a work site to other areas, including into households, transmission that might go on to affect schools, moving into resulting in hospitalizations and even deaths. So this just shows that although we have the number of transmissions that happens in the workplace itself, it doesn't end there. And preventing transmission in a workplace can have the result in preventing a branching tree of transmission down the road. So a couple of things that are happening right now is that we're looking at for ongoing support from businesses to implement good COVID safety plans. We see that most are, and most have been very amenable to improving them when necessary, which we're grateful for. Then also this new protocol for outbreak management. When there's transmission in workplaces, 3 or more cases for the most part, will generally lead to a closure to try to break that transmission and prevent these sort of clusters, these large growing outbreaks that we've seen in some cases. This is a new order. The provincial health officer and all of the regions will be implementing that going forward. Here's just a screenshot of that order. And again, this is directing WorkSafeBC to support the health regions in this, whether that's environmental health officers in the health regions and also inspectors from the WorkSafeBC will be engaged in this work, trying to limit onward transmission when clusters occur. Now, on to vaccination. So as well as the non-pharmaceutical measures that I was describing, things like the safety plans in workplaces, closures when necessary, of course, vaccination is expected to help prevent transmission and has in some sectors already in BC. I won't read out every word of the BC immunization plan here, just to say that the initial phase was really looking at people at the highest risk for severe illness and death. But people in long-term care facilities, living there or working there, people who are awaiting placement in such facilities, certain healthcare workers at greatest risk, people working in the COVID-19 wards, ICUs, and related units, and then some remote populations as well that were found to be at high risk. Now we've gradually moved more and more into an age-based campaign, starting to vaccinate older adults, starting with 90 plus and then moving down in ages, as well as more and more healthcare workers throughout the second phase, which is largely wrapped up. Current phase, phase 3 right now, and we're moving through these age groups, moving down from the oldest age groups to younger and younger groups, as I'm sure that you're aware. And right now we have, in fact, opened up vaccination through specific opportunities that I'll describe later in the presentation with the Astrazeneca vaccine to people aged 40 plus across the province, with a special focus on trying to provide easier access for that vaccination for people living in certain high-risk neighborhoods that I'll mention. So this is the current state of the vaccination program, and over the next 2 months, you'll see the age-based campaign continuing to make its way down through the age groups until the plan is that every adult in British Columbia will have the opportunity to be vaccinated by the end of June. Worth noting as well, you'll see the bullet there, the priority frontline workers have been vaccinated in many health regions, in Vancouver Coastal Health and in Fraser Health. That has included people working in food manufacturing and warehousing, in some other high-risk sectors. That's expanded to include, in some regions, teachers, people working in daycare, first responders, such as people in police departments, fire departments, emergency medical services. This does vary a little bit from region to region. Each health region, depending on the risks that they're seeing, is going to differently roll out the frontline worker aspect of their vaccine campaigns. But we had a great uptake. I believe over 20,000 people working in the high-risk sectors in Fraser Health and Vancouver Coastal Health so far have taken this vaccination program with a lot of support from many of you on the call. I see some of the familiar names who are really well engaged with that. This is just just a slide sort of showing the effects of the vaccine once it reaches an age group. So the purple lines there are just showing the coverage with one dose of the vaccine. So you'll see there that people aged 80 plus have largely been vaccinated. Well over 3/4 of the population has. We see that now 70 to 79 has climbed as well. And the younger age groups have started to a little bit. 55 to 69 is starting to come up at this point in our campaign. And then younger age groups too, like 18 to 54, most of those being healthcare workers or some people in frontline sectors that have had access to the vaccine through those specific programs. And if you look at the row below that, there's some good news. You see as the vaccination coverage goes up in an age group, the case rate and the hospitalization rate and death rate has come down. So you see that very clearly in the 80 plus column. And although there's been lower hospitalizations and deaths throughout the pandemic in the young age group, we see that to the same pattern in 70 to 79, bringing the transmission down a little bit more, and we expect that we'll be able to do that. Most importantly, as we get into these younger age groups, they're at lower risk for severe illness, but certainly at risk for acquiring and transmitting COVID-19. So it'll be very important that they're vaccinated as well. Speaking of the specific products, there's a whole, this is just to put together the whole spectrum of products that are out there. There's a number that are in the pipeline or developed, 4 that are approved in Canada, which would be the Pfizer vaccine, Moderna vaccine, the Astrazeneca vaccine, also known as Covishield, as it's produced in a couple of different places. And then finally, the Johnson & Johnson one, which has been approved, but not yet part of our program in BC. So these are the ones that you'll probably have heard of in terms of their dosage. All of the ones that we're using in BC right now, the Pfizer, Moderna, and AstraZeneca vaccine, all require two different doses. And right now we're working on getting that first dose distributed as widely as possible. The Pfizer and Moderna vaccines have been largely used through the age-based program and also the extremely high-risk program for people in long-term cares, extremes, and then the clinically extremely vulnerable populations have been provided with these vaccines. We're continuing to book these on an age-related basis. And then as well as that, the AstraZeneca vaccine has been applied both to the high-risk worker communities and is now being directed to people aged 40 plus in a variety of neighborhoods through health region clinics, and also available in pharmacies through pathways I'll highlight. I hope that some of you may have already accessed that. Anyone over 40 can now get vaccinated through pharmacies in BC. On that program, I just wanted to give a little bit of detail. This, again, anyone over 40 is eligible to go and do this. There's a link here. The government of BC is linked to all those pharmacies. As you can see, there's a large number of them in British Columbia. This is just a screenshot from the lower mainland. There's also a list that's provided by BC pharmacists of BC, just to try to make that more clear. This can be I think a pretty a process that some people have found challenging, because some clinics, due to demand, which is a good thing that people are interested, some of the pharmacies might be out of the vaccine. So, but right now many of them are booking vaccinations as we speak, and probably many of you have been or are aware of people in this age group of 40 plus who have access to this vaccine. So we really encourage people to go ahead and do this, and this is available right across the province. And I'm sure the Safety Alliance would be able to share this information with all of the members, again, for people aged 40 plus. Now, specifically for people living in these neighborhoods or community health service areas, as they're called in government terms, there's, as well as being able to go and get vaccination at a pharmacy, just recognizing that we want to make this as easy as possible where the risk is greatest. People living in these neighborhoods can register online, providing their particulars, the name, contact information, and what area they're living in, and will be contacted to book an appointment in a health authority clinic. So rather than needing to find a vaccination pathway through a local pharmacy, you can get vaccinated through the health authority. And this is just recognizing we want to make things as, again, as straightforward as possible for people who are in the most high-risk areas. So in the health region that I'm working in, Vancouver Coastal Health, we see Kensington and also Squamish as areas that have been designated for this program, as well as a number of them in Fraser Health and other parts of British Columbia. So that's worth being aware of if that's where you reside. Again, I've just posted that information in this program. Again, this is all available through the BC vaccination, the BC COVID vaccination webpage. And so one can follow the links into that and get registered for that vaccination pathway. So that's all I had to share. Hopefully that's a useful update on where we are in the pandemic right now. Again, a challenging time, but I think helpfully with a number of tools available to us, both in terms of control of transmission. We've seen all of the orders and the restrictions, various measures that are in place, all of the things that we can do as individuals in our day-to-day life, and then also the ramping up the ongoing deployment of our vaccination program to a large number of British Columbians. So I'll leave that questions page up. I'll hit stop share, I suppose, or, so that we can move into the next phase of this of the session. Thanks.
Thank you, Michael. A really strong foundation for all of us in looking at where we are in this pandemic and where we are going with vaccinations to support all of us in protection that will move us forward from this pandemic. So with that, the presentation will be available in the resource package. I just wanted to share that with you and move into the questions. So as I mentioned, making sure that you have the opportunity to put your question in the Q&A chat at the icon at the very bottom of the screen. And the first question to you, Michael, if you were to have 3 positive workers, would the whole company automatically be shut down, or does WorkSafeBC decide if you can or cannot stay open?
Okay, great question. And this would be assessed by your regional health authority. So medical health officer working with the contact tracing team would gather further information in most cases before applying this. So looking at some things, if people have acquired infection outside of the workplace, if there's not thought to be transmission in the workplace, this would not necessarily apply. And as well as that, in some cases, if the workplace is deemed to be critical to some public function. So for example, for the food system, which many of you would be a part of, there's exemptions to this. So this is laid out in the order as described on the provincial website. We could probably share that through you, Lisa, and colleagues. So it's not necessarily an automatic that case count will lead to a workplace being closed, but it is the direction from the province that this closures will proceed in the absence of those good reasons to stay open. So that's the current direction that we have.
Excellent, thank you. we're receiving a number of questions about what they've heard in March about the Astrazeneca workplace vaccinations. They're wondering how can a company find out if they are on the list or radar of the health authority for any future phase of the essential worker vaccine rollout. So these are for food processors that haven't taken the opportunity in March. Is there a second opportunity for those companies and those workers?
Yeah, this is an excellent question because we really appreciate it. Things have been fast moving in the rollout of vaccines with the supply that we have changing, having certainly some disruptions at different points. And so being alert and nimble to all of this has been a challenge, I think, for both regional health authorities and no doubt for the general public and for employers like you who are interested in supporting your staff to be vaccinated. In the case of AstraZeneca vaccination, this will vary a little bit across from region to region. Again, each region has been given the latitude to try to deliver vaccination where it's most necessary. So, for example, in Fraser Health or Interior Health, there's attention to farms as high-risk sites that is less so the case for Vancouver Coastal Health. Meanwhile, Northern might be looking at certain industrial applications that aren't as common in the South. So it does vary from region to region. What I would suggest, and the Safety Alliance has been a great support in this, is writing. I know if I can say so, Lisa, writing to the Safety Alliance, expressing your interest in this, because there's been a great partner in keeping a database of the interested workplaces. And then at such a time when we're able to offer vaccination again for the sector, then we'll be able to contact you. So registering your interest is an excellent idea, and we will try to proceed with that. Speaking for Vancouver Coastal Health specifically, where I'm an MHO, our team is messaging in the chat that they can help to collect that. That's for our region in particular. So we're glad to do that. And if you've been reached previously, you'll be reached again. So people often ask about second doses and so on. So we know who's already been vaccinated, and we'll certainly loop back to you when a second dose is a possibility.
Okay, thank you. So just reinforcing that for those, please send us your name and the employer name as well, and obviously the individual that is the key contact to our organization. We're going to continue to compile that list that will be forwarded to the relevant health authorities. So thank you, Michael. The next question, looking at if you need help taking note of employers wanting to be on the list, just thank you, Christina, for that offer. Do you have any insight into how many manufacturing facilities have been issued closure orders? So really looking at the outbreaks in particular with manufacturing and food processing, and what can a business do to prevent a shutdown from occurring if someone received COVID that comes into the workplace? So perhaps acquired it from a family member.
Yeah, so I don't know the specific number province-wide. My understanding is that it's probably, if I could say, it's over 20 and less than 30 is what I've been told. I don't want to, don't hold me to a specific number because there could be new ones issued, as we speak potentially. So it's not an extremely high number, but however, I think that it's important. And that's not all processors, I should say. That's the number of workplaces in general. Vancouver Coastal Health, a large number of those have been restaurants. That's been a major area for us seeing clusters. To my knowledge, and I did just check, none of our current closures affect this sector. So we don't have any processors or related employers in the sector closed. Perhaps due to the success of the vaccination rollout campaign, we hope that that's contributed to prevention, likely also to some of the good measures that are in place, although we continue to encourage everyone to get tested with symptoms and to carry out the same measures that you have before. We don't have processors closed within Vancouver Coastal Health, to my knowledge. There may be some elsewhere in the province, however.
Thank you. And I will say and reinforce that I think over 15,000 individuals in the Vancouver Coastal Health region were vaccinated. So that is a huge win, I think, to all of us in seeing how many are taking advantage of this invaluable opportunity to become vaccinated.
Yeah, and if I can share, Lisa, just from our experience as a health region, we know, and this is why we offered vaccination in Fraser Health and the VCH too in the area, and I think Interior Health as well, to some extent, was able to do some vaccination in the sector. And knowing about the risk in the sector, we would see previously, I think week to week, often clusters and outbreaks as a normal course of our work. And that's really just vanished from our blotter over recent days. Not to say that the risk isn't there. We need to continue with all of the same good measures, but it has just not been to the same extent it was previously. So the vaccination really does work. This has been shown internationally, globally, in a variety of sectors in Canada, age groups too. So I think that the benefits of this are starting to pay off, and more uptake when the vaccine is available will serve us well.
Excellent. No, that's really good news. That's really great news. Could you give us some insight just into how the contact tracing works? We've had a question on that, and really help us understand. And do all the health authorities follow a similar process in moving that forward?
Yeah, it's pretty similar. If a new case is diagnosed, they'll be reached by public health and interviewed in depth to look at their potential close contacts. So this could be the household members that they live with. This could be social contacts, and certainly it would include looking at their workplace. And we're really looking for people who are in close, sustained contact with the case. So the typical time frame that we might talk about would be 15 minutes within that 2-meter distance. Sometimes we would be concerned about contacts that are a little more brief than that, but quite close. So if people are working in very close proximity for a certain task, they might be deemed to be close contacts. Or if they're a little further than 2 meters, but they're working in the same room and in an enclosed space for many hours, they could also be asked to isolate. So public health will assess this at length. We have very experienced contact tracers who are doing this with the support of medical health officers, making these decisions on who in a workplace needs to isolate, who might need to be notified, but perhaps doesn't need to be isolated and quarantined from their normal life for a full 2 weeks. Looking at the threshold for who will get which intervention, and then last of all, sometimes notifying the entire workplace if it's thought to be necessary. If someone seems to have had widespread exposure, there's trouble identifying who might be identified. Many workplaces have taken on some of their own contact tracing, if you will, trying to isolate people who are known to be close contacts. Generally speaking, we ask that you wait for public health to do that. You can certainly work with us if you know that people are that this process is ongoing. Definitely, you can work with the contact tracers. Inform us if you know that there's close contact that's part of the day-to-day on the workplace. We always want to gather more information, certainly. But generally speaking, we sometimes do. We have the experience of entire shifts of people or entire workplaces being put off for several days who might not even need to. So again, that proactive work from employers is great, but please do so in concert with the health region, because sometimes we might redirect, we might increase the intervention, or in some cases we might even decrease or be able to shape that a little bit, just to make sure that we're really on target for what the true high-risk exposures.
So that's really good information. So in the event that an employer becomes aware of some positive cases, and if they're thinking that many within their facility may have been in contact, is to contact the health authority first.
Yeah, absolutely.
Okay, excellent. Okay, moving forward with an additional question. Again, more interest in registering employees who've not been able to attend the first vaccination. So that's great. And we will capture that information. Thank you. Looking that, recognizing that none of us know what the future will bring, can you speculate about whether or not our current safety protocols, like our current PPE, will likely be in place as we transition from summer months into the fall? So looking at that future lens, what are your thoughts?
Yeah, I suspect that in workplaces where there's a high degree of contact by the nature of the work and the space, I suspect that those safety plans will continue for some time. I think places where we might see some relaxing of that might be outdoor spaces, for example. There might be some recreational contexts where we see some relaxation of distancing protocols and so on. But I think workplaces that have been at a high risk, even as we have vaccine coverage and hopefully diminished transmission at some time in the future, I think will still be very important to keep in place distancing to the extent possible, use of barriers where possible, certainly masking in indoor spaces. All of those things will be important. We expect to still have COVID circulating in the community for some time. So I would not see those being rolled back very soon.
Thank you. A question on the second dose and the timing of that 4 months versus other places around the world that are providing that within a month, and just looking at, is it still effective is the question. Can you just comment on that?
Yeah. Yeah, we've had our national bodies and provincial bodies, the BC Centre for Disease Control, have looked at this very closely, trying to optimize the supply of vaccination that we do have. And we've seen some other places in the world. The United Kingdom's had good success with this, controlling their pandemic to a large extent. That widespread coverage with a highly effective single dose is definitely a good first goal, and probably better than lesser coverage with a slightly higher, slightly more effective 2-dose regimen. So in short, we'd probably, if we can get to 60 or 70% coverage, for example, with a single dose, we'll be in a much better place for preventing transmission at a population level. If we had half of those people with twice the doses, it's not projected by the modeling, by the science that's been and the research that's been done on this to be as effective. So in terms of bringing the pandemic under relative control sooner, widespread use of a single dose is thought to be best. However, we do plan, of course, we want to make sure that people do get their second dose. In BC right now, the plan is to get the second doses done 16 weeks after the first dose. This is the current schedule. Making sure that people do have those regimens tied off would be important as well. But again, holding those second doses and allowing us to have more widespread coverage is very important right now. And for countries that are perhaps a few weeks ahead of us in terms of their campaigns, we've seen really good results with that. So I think have good confidence that this is the way to go.
And if I'm not mistaken, is there 100% effectiveness against fatalities as a result of one dose?
Yeah, this seems to be the case with the Astrazeneca vaccine. It's been extremely effective for preventing severe illness and mortality. So that's even though there's the reduction of, there still might be some possibility of infection, the reduction of severe disease has been very encouraging.
No, that's very good news. A question on the current capacity of ICU in Vancouver Coastal Health and the current occupancy rate right now. Do you have that information?
Yeah, I don't have it right in front of me, and I always hesitate to try to riff on numbers that I've seen and may or may not have fully committed to memory. Right now, definitely people working in the system will tell you that it's stretched, that it's definitely, we're seeing a high occupancy in terms of hospital beds and ICU, but it's been, I think, within a manageable range at this point. We're not seeing at this point some of the, I think, the more severe, I guess I won't say that any systems are overwhelmed yet, but so the stretching of the systems that we've seen in some other jurisdictions in Canada at this point, this is being monitored extremely closely. You saw from the Minister of Health quite recently an extremely detailed presentation on hospitalizations, ICU capacities in British Columbia. This is being monitored day to day, if not hour to hour, with an eye to increasing measures if necessary, and making sure that we don't get to that point of people needing to, people being unable to have necessary care for COVID or for other illnesses. So right now in VCH, we don't see that the system's been tipped over or full. We're not needing to move into our surge capacity at this point, but it's being managed very closely. And this is, I think, exactly what one of the major concerns right throughout this pandemic is not seeing us get to the point where we have to have severe rationing of the ICU, not seeing us get to the point where people are unable to have the care that they need. It's absolutely crucial to keep that exactly that close eye on things.
Well, that's great news. That's good to hear. Thank you, and reassuring. So an appreciation to you, Dr. Schwandt from Workplace Health Services at UBC. I just wanted to share that acknowledgement for the great your team are doing. So excellent. And then really looking at a specific question again, which is great to hear about vaccinations. What is the most current plan to provide vaccines to frontline worker groups such as childcare, daycare staff, firefighters, and other public safety officials? With vaccine issues has caused delays, which we know and we've heard about. Anything to add than what you've already said?
Yeah, if within Vancouver Coastal Health and Fraser Health, right now we're moving out vaccination to teachers, to people working in daycares, and to those first responders that were named. So if you are working in such an organization and have have not heard yet, that's something I would expect to be contacted imminently. You could even paste your name and organization into the chat, and we could follow up with you on that. But there's a pretty detailed process to reaching licensed childcare, for example, reaching schools, all of which we've been in touch with closely throughout the pandemic, as well as our partners in police, fire, and emergency medical services. Again, this varies a little bit across the regions. Our partners, I was talking to a colleague in Island Health earlier today, and right now, because they haven't had that sort of workplace transmission that we're dealing with in Vancouver Coastal Health and Fraser Health, their allocation right now, they're still focusing on vaccinating, looking at age as the major risk factor for severe illness and death. So each region is going to be a little bit different. There's some latitude in terms of finding the risk and going to it with vaccination. So there's going to be some distinction. There's a common framework across the province, but each region is going to have slightly different risks and slightly different approaches to getting vaccines out. But in short, if you're in Vancouver, Coastal or Fraser, those sectors are getting a lot of attention right now with quite a number of people, in fact, taking up vaccination every single day.
And we as an organization are trying to help support information to all of our members on our website on this information as the different health authorities, target their high risk strategy in this area. So just to reinforce that messaging. Another question on the second shot. So for those under 40 who got the Astrazeneca for the first shot, what are they going to get for the second shot? So looking at, what will happen in that case?
Yeah, that's a very good question. And I think a good opportunity to talk about Astrazeneca, because many people responded when public health was able to extend the availability of Astrazeneca to many people in the sector. Many people, and I know many people under 40, took up the vaccine to protect themselves, their loved ones, and their communities at large, really. And it was really deeply appreciated. And I think that the emergence of knowledge around some of the side effects, most particularly the clotting side effect that's been seen in a small but important number of people, of course, is of great concern for many. We received many queries from people that we've been talking to about exactly that issue. So I think it's important to note that this is a rare thing that's happened, but was detected at an early stage by the monitoring systems in many different countries, including Canada's participation in that. So this is, I guess, a sign that if side effects are found with any of the vaccines, the systems in place are able to respond to it, put a pause on the distribution if necessary, reopen it, or maybe tweak it in some cases. So not giving a vaccine to the most at-risk, youngest people for AstraZeneca, for example, which brings us back to younger people under 40 who might have received the AstraZeneca vaccine and are now in the position where the current stance from BC is that people under 40 should not receive that vaccine. So right now, at this point, by policy, people would not be eligible for a dose of AstraZeneca if they're under 40 due to that potential risk. Of course, there'll be ongoing study of that risk over time, and maybe within 4 months' time there might be a difference because we'll have more knowledge of that effect and what the risk is. We're playing it relatively safe right now with the direction that we've given. So it's possible that people might be started on a new course, given 2 doses of Pfizer or Moderna. They'll still have the effect of their first dose on board from the AstraZeneca dose, which is very important. But at this point, we would not be recommending that people under 40 should have that second dose. People over 40 can, that would be just fine. And I know as time flies by, it won't be that long before some people in this group are eligible for their second dose. And that's, I guess, the main update that I wanted to share about the AZ vaccine. Thank you.
Another question just on, I guess, clarity, and I know you've shared a lot about how decisions are made, for closures, but there's a question on where there have been a challenge finding data on how health orders are determined. Is that something that's publicly available, or is there information referenced on this at all?
Yeah, so there is some on the WorkSafeBC website. Would probably be the best place to look for a description of the new closure process. I mean, this is very new, as you'll know. This was announced quite recently by our provincial health officer. Some of the details have been formed just in the most recent days. What the approach will be with feedback from each of the health regions. So that's something WorkSafeBC would be a go-to site for that. So if either your regional health authority or safety alliance could maybe help to distribute those links or those pages as they're up, they describe the process quite well. And again, the key thing to keep in mind is that each of the health authorities will be monitoring for clustering of cases in time. So seeing a number of cases that occur in quick succession that are within within one workplace would come to our attention, and the direction is that those would be closed, absent evidence that the infections weren't workplace related or some overriding public function that the site absolutely can't be closed. So for example, some emergency services where a case cluster would not lead to an automatic closure of the workplace because of the necessity for day-to-day life.
In one of your slides, you shared information just to where the risk exists in terms of higher outbreaks. So just looking at, the thinking around the public health orders as the reasoning behind making these decisions. So one of the questions really speak to the closing of indoor dining. Can you just speak to the risk level at that particular decision? And I guess the outcome of that is closures and only having patio availability for dining.
Yeah. So overall in British Columbia, there's been the feeling at the regional and the provincial level that with the right measures in place, most operators have been able to run indoor dining without high risk to transmission between parties who are attending or between the parties and the staff who are working there, or vice versa. It's important to keep in mind, of course, the people who are attending are going to be in close proximity with one another, and we've been directed, even with these restaurants and bars open, are not meant to be gathering indoors with people from outside of our households. So I think that seeing some of the transmission and knowing that there had been transmission taking place sometimes between non-household members attending restaurants indoors, and noting that is a risky venue, of course, for transmission of that nature. The province has taken the direction of limiting restaurant dining to outdoors only, noticing there's quite a strong difference in transmission risk when we come outside. Some estimates saying that it's 10 or 20 times less likely to be transmission outdoors versus indoors. So knowing that, trying to have a targeted measure, looking at indoor dining as a risky context while preserving the function of restaurants and bars has been the direction that's been taken. I think it's important to note, though, that we continue to look at this very closely as a regional health authority. Not all patios are created equal. I'll tell you from direct experience, both in on and off the job field work, that that a patio that's effectively a tent with four walls to it and that creates an indoor space is not something that is meant to be described in the outdoor dining allowances. So we do have a lot of attention to that from the regional health authorities and from WorkSafe, trying to make sure that the venues that are open are truly open air and should have to not create the high risk environments that might occur indoors. So there's basically trying to fine tune rather than closing the entire sector has been the direction that BC has taken on restaurants.
Thank you for that clarification, Michael. There's a question that speaks to, and this, I guess, the foundation looking at the risk level from the USA versus Canada and having frontline essential workers traveling between those two countries. Is there any, can you just comment on the risk level on that and whether they would be considered in the higher priority area for vaccinations?
So is this, I guess, people who are residing in the US and working in Canada, or people who move to and from the US as a part of their work? I guess.
Essential technicians, so working across the Canada-US border on a regular basis. So this, I guess, could fall under a number of different specialties, right? And I guess just understanding what that would be for risk.
Yeah, there are exemptions for people who have truly essential functions. There's a federal processes for evaluating this, whether or not someone is essentially irreplaceable in their function, and a number of people who do have this sort of exemption such that they can come and go. We've had within Vancouver Coastal Health some very specific technicians who when you talk about specialized knowledge, and there's people who there's a single digit number in the continent, we're told, who are able to carry out certain functions. So they've been allowed, their movement has been allowed for that reason. this is definitely a very small number of people, and these are people who are instructed to still manage their risks. So they might be, their movement might be permitted for the purposes of their work, but this does not exclude them from the other measures that are in place to prevent transmission. Because we do recognize that there's in some contexts in other countries there might be higher risk. There might be different epidemiology in terms of the variants that are present, and of course all of that is changing very rapidly from week to week and day to day. So we want to make sure that we're managing the risk of importing COVID, and in particular its variants, into the country. However, there have been some allowances that have been put in place thoughtfully and are quite closely monitored by CBSA border services to allow for us to continue to have certain essential functions taken care of in Canada.
Would they be considered, to your knowledge, like priority for vaccinations just because of that movement?
Yeah, well, right now in the BC vaccination framework, for example, cross-border truckers is one group that's been named because there's several thousand known, and they've been named in the for I guess potential next steps in our essential worker campaign. So after, with food processors in some regions having been vaccinated, teachers, people in childcare, first responders, that is a group that's on the list. So I have not seen specifically technicians of an essential nature being slated for vaccination. However, there's definitely attention clearly to workers who do move across the border in commercial transportation. So I think that that's something that the province, the different regions, certainly regions with a large number of those staff coming and going would potentially attend to. So that's a very good question. And I know that, again, it's a small number in the region where I work in Vancouver Coastal Health, although my understanding is that there might be more in Northern Health due to some of the industrial activities, I'm told by colleagues there. So that's something they might choose to look at.
Okay, thank you. Looking at effectiveness of our current vaccinations with the variants we're seeing now, can you just comment on that?
Yeah, so I won't try to sum up the matrix of effectiveness of each of our vaccinations against each of the variants right now. Generally speaking, we have good effectiveness across the board with our vaccines. They're thought to still provide effective prevention. That does vary. Some of the vaccines have decreased effectiveness, relatively speaking, against some of the variants, although we're seeing that decrease might be from 90% to 80% effectiveness, for example. We're not seeing any vaccines that are, for the most part, failing utterly against any of the variants. With COVID-19, very few statements are going to be guaranteed over the course of coming months. However, there will be more variants with widespread circulation globally. We expect the emergence of more variants, and the nature of selection pressure is such that those that are able to evade vaccine-mediated immunity or immunity to previous infection are those that are going to be selected for. So we expect that there will be new variants that emerge over time, and so this is something we need to keep a close eye on. The technology that's been applied to developing these vaccinations, quite happily, does seem to be amenable to updates for new variants over time. So we might find ourselves in a space not dissimilar to influenza, where we see vaccine updates over time. So whether people need to be boosted with new vaccines in the future, or whether or not people who have not yet received a vaccine will receive a different one in the future remains to be seen. But it's definitely the case that the issue of vaccine evasion, or sometimes called resistance, is a real phenomenon potentially, and we need to keep a close eye on that.
And definitely something we'll be keeping a close eye, I think, for the future. Last question, I know we're approaching our time here. With the reduction in age group for the Astrazeneca, will people 40 to 54 who registered be expected to now contact pharmacies, or will they still get a call from the registration system?
Yeah, so people who have registered, they're waiting for a call through the age-related system will still get that call. They won't be taken off of that list. So if you go ahead and get vaccinated through a pharmacy, when that phone call comes, please answer, please let them know, so that for efficiency, they can take you off and move on to the next person waiting. But no, you will not be, people who have enrolled in this system will not be taken out of it now that their age group is available through a different pathway. It's a complementary pathway, but it won't remove anyone who's signed up previously. And thank you to those who have registered and patiently waited for your vaccination.
Yeah, thank you. Thank you to all of you on the line. We're going to have to stop here. We're closing in on the hour. We'd like to take a moment to once again recognize you, Dr. Schwandt, for being with us today to provide us with valuable answers to so many questions. If we did not get to your question, we'll do our best to respond to them in the follow-up from today's session. And again, of course, we'll include the package of resources for you. A brief reminder about our upcoming webinar. In addition, we have our 5 open learning classes on various topics. You can sign up now for 3 Ask Me Anything webinars with our safety advisors during NIAR Safety and Health Week in May. Registration will also open for the May 27th webinar on Government and Industry Town Hall, the road ahead for BC businesses in the recovery, with the Minister of Labour, Honourable Harry Baines, CEO from Sunripe, Leslie Bradley, and our CEO from Fine Choice Foods, Jason Longden, and as well joining us, CEO from the Canadian Mental Health Association, Jonathan Morris. So please join us. And again, registration is open for that at the end of May. Additional resources are available on our website, so make sure you visit our media library for on-demand content, news, and resources and event information. Thank you all very much for joining us today. Please take the time to complete the survey. It'll appear in your browser shortly, or check your inbox for a link to share your feedback and suggestions to help us improve future town halls and webinars. We'll email you tomorrow with a link to the recorded session from this town hall today, slides, and all the related resources. Feel free to share these and follow us on social media for more news, resources, and future events. Thank you all, and take care of yourselves. Thank you.